and welcome to this week's Fibro section. So, hope you're all well, hope you're all enjoying the lifting of lockdown in the UK. So we are now, from today, which is Monday, I don't know what the date is, shops reopen and hairdressers reopen, so we're getting our hair cut tonight, getting my nails done tomorrow, so lots of things happening. It's also a bit nerve-wracking, if I'm honest, but anyway, that's for another time. But let's get into this week's Fibro section, which is about nausea. So let's get out the trusted notepad and let's get cracking with today's section. So for those of you that don't know, I have quite a bad phobia about sick. There is a word for it. I can't remember what the actual technical term is for a phobia about sick, but I've had it for many years, to the point where if we're sitting watching the telly, I have to have my finger on like the mute button just in case anyone's sick. So this is quite a big one for me to do, talking about nausea, but it's really important because it's something that I've dealt with a lot lately. So fibro patients can experience nausea and or vomiting. Secondary conditions like thyroid, depression or anxiety and irritable bowel syndrome can all cause nausea. Also, the widespread pain with fibro can also lead to it. Many of the medications used for fibro carry with them the risk of nausea as a side effect. It can be difficult for fibro patients to determine where their nausea is coming from if they have a number of conditions and medications. Like, where is it coming from? Is it coming from that medication? Is it coming from this condition? You know, it's difficult. I suffer with bad nausea, which is controlled with medication usually. Actually, I was going to show you the medication that I'm on for my nausea, and it's like an anti-sickness. I will get that in a minute and show you, but it's prescribed by the doctor, so you would have to ask your GP if you're interested in that one. But I still get bouts especially after my evening meal. I get really bad nausea, and I don't eat a lot either. I eat a small amount, and I'm currently going through it at the moment because I've changed my pain medication from nortriptyline to duloxetine, and that has brought a lot of nausea on. My go-to treatment that I use is ginger tablets. They are brilliant. They are for me anyway. Everyone's different. Like I always say in these sections, what works for me might not work for you. So please don't take it as gospel. You know, you've got to try the things to see whether it works for you or not. But ginger tablets for me are brilliant, especially the ones after the evening meal. So if I feel like really sick after my evening meal, I take a ginger tablet, and usually that will stop it. But it doesn't help with the medication change, because I guess that's the medication causing it and not a digestion issue, if you see what I mean. So how can we treat nausea? It can be treated in a variety of ways. Eating small meals throughout the day as opposed to 3 large meals. Eating slowly and not rushing meals can also help. Having low-fat, nutritious foods that are easier to digest and foods that are slightly cooler can minimise nausea developing. I never knew that. Rest after eating a meal, but in an upright, slightly inclined position. So I guess sort of, so you're upright, but you're slightly back. Avoid acidic drinks like orange juice, but drink water in small sips regularly when you have nausea, that is, you know. There are over-the-counter medications which may help nausea, but ask the pharmacist on advice on what to take so it's safe with all your current medications, or like I say, you can have a GP appointment a lot of them now are on the telephone, aren't they? And you can ask your GP for advice on if they can provide anything for your nausea. They may prescribe something to help, and like I say, I'll show you the one that I'm on soon so that you can see what I take. If you want to go down the herbal route, like I say, ginger is great. Vitamin B6 and acupuncture can also help. Between 40 and 70% of fibro patients suffer with nausea. So that's quite a lot, isn't it? Some days can be just brushing your teeth and gagging, which I do all the time. Or being sick at the smell of food cooking, and I have that as well. It's often like if something's cooking, I'm like, oh my goodness, who's cooking that? It's making me feel sick. Or like after I've cooked an evening meal, we've cooked an evening meal, I have to get my Febreze spray out and spray the whole bungalow because I just have to get rid of the smell of cooking because it makes me feel sick. So smells are a big thing with me. There is a new Febreze spray as well that has hardly any fragrance. It's like a fresh air Febreze. So it gets rid of smells, but without that harsh, because you can get really strong. The one we've got is really strong fragrance, and even that makes me feel a bit like, don't know what's worse, the smell of the cooking or the smell of the Febreze. So yeah, this new one is like a fresh air one, so that might be a good idea. But obviously if you suffer with asthma and things like that, that's not going to be a good option. Your option probably then is to open doors and windows. Magnesium's benefit is substantial. I take a daily supplement of magnesium. It can also be taken in liquid form. If you have a lot of stress in your life, then nausea will be worse. And I'm going to link, I know I've definitely got one video on stress, but I might have more than one, but I'll link them for you. Whether you choose traditional methods of reducing nausea or you lean towards other methods, make sure you keep your GP informed. They need to be informed of what you're taking, what's happening, what's working, what's not working. Nausea, just like pain, is another indicator that the body is letting you know something isn't right. So a bit like my new medication, the duloxetine I'm taking at the moment, my body's like, something not right here, because, you know, and I'm going to make you feel this because I don't like this, what's coming into your body. So don't ignore it. Don't ignore the nausea. Ask for help and try some of the suggestions I've given you today. And if you have any suggestions for nausea, definitely write them down below. Another suggestion I would give you as well is the travel sickness bands that you can get. They're like in a bracelet form, like a stretchy band. And I'll try and link some in the description for you actually. And you just pop them on your wrist, and you have to, like, I think you have to put 3 fingers from your hand in, and then it's on that last finger point that you put, there's like a little nodule on the wristband, you'll see it. And that's supposed to stop, I can see like there's a vein here in my wrist, and I can see that's where it would hit. And that's supposed to, like, the pressure of it is supposed to stop the nausea, and you wear them on both wrists. I wore those through my pregnancies because I had really bad, like, I wasn't sick, but I felt sick all the time, morning sickness, and they really, really helped. So mine have got lost in transition somewhere, so I'm definitely going to be purchasing another set because they are so good. The other thing is definitely stay hydrated, drink water. If you're feeling sick, water is the best option, and especially if you're dealing with a medication side effects, because the water can flush out that quicker, not the medication, but you know, that side effect. But don't take great big gulps because that will make you feel worse. Take just small sips regularly, but make sure you stay hydrated. Even if you're actually being sick, then try and have dry things like dry crackers, dry toast, that sort of thing that you can, you know, dry biscuits, just things that you can have to maintain that your body what it needs, you know. But like I say, please don't ignore nausea and vomiting. Please don't ignore it. Ask your doctor for help and advice, or your pharmacist, because it could be an underlying cause of something else that you're not sure of. Let me go and get the tablets that I take to show you. Right, okay, so these I'm trying to read it back to front, metoclopramide or something. These are what I take for my nausea. I can take one 3 times a day if it gets really bad, because what this tablet does is it pushes the food down from your stomach quicker, so it clears it so that it's not just sitting there and making things worse. And this is 10 milligrams, but at the moment I'm taking 1 in the morning before I eat anything. So that's what I take, but obviously you can ask your doctor what they think is the best medication for you to take, if there is any. If not, go down the herbal route. Like I say, try the wristbands, try the ginger tablets, and definitely let the fresh air in, because that's a big thing as well. But yeah, like I say, if you've got any suggestions yourself that works for you with nausea, definitely comment down below, and we can like have it's a bit like a map of knowledge, isn't it? So that we can all gain from each other's experiences. So don't forget to hit the thumbs up if you've liked this video. Don't forget to subscribe if you haven't done already. Follow me on my social media on Instagram, Twitter or Facebook, because I try and post there as much as I can. And we can chat over there. I try and reply to all your messages. I love you all lots, and I will catch you on Saturday for the weekly. Bye.